Hi, this is Luke Kang. Today is very excited announcement regarding the zirconia shading because I've been researching for more than 12 months which liquid system is best, and then I've been struggling, and then I spent a lot of time, and then I listened to what they said. The key is here, regardless their technique, their quality. I would like to get to the point, and then I want to make the system as close as possible. But unfortunately, the other liquid system out there is great. I mean, they show me the great efforts. It's absolutely beautiful. The problem is, I cannot use the entirely as my company. Probably as I'm bad technician, or maybe I'm not good technician. I don't think so. But today's Shin will going to show you the excited moment regarding full mouth shading, how to do it, step 1, 2, 3. That's it. This is what I recommended, my colleague, truly, and then time saving. You got predictable result every time if you get the good sintering oven. Okay, so stay tuned. Thank you.
Hi, my name is Shinsuke Ashina. Today, I would like to talk about some of my zirconia cases that I've done, and I basically like to talk about and show you how I do my zirconia coloring. And before I do my actual coloring, I like to show you one of my cases. And probably in the past you might see my wax up on Facebook, but I just like to briefly go through my case again. So basically, this is the case right here. I'm almost ready to cement it. Okay, so you can see all the details, the tissue, and also the color. And this one, it's basically a monolithic zirconia. There is no porcelain layer on the facial. One of the reasons why we chose to do full contour zirconia in this case is the patient has issues with their occlusion, and the doctor didn't want something layered. We like to have something more stronger and make sure that it's going to last long. So that's why we came with monolithic zirconia. And for monolithic zirconia, good thing is I have this technique to make our crown really live and really nice. So that's the reason why I'm here today, to just talk briefly about my technique. So about this case, originally this case was done by me and Dr. Alan Bogosian in Chicago, Illinois. We both discussed about this case very, we took a lot of time to make sure that this case will work fine. So first, we did it from the wax up. It came from the wax up. We did all the diagnostic wax up, make sure occlusion and everything is right. And after that, we did a copy mail from the wax up. And then after it was done, I actually used my coloring liquid and colored my full contour zirconia. So, as you can see, that's the wax up. This is the original provisional, by the way. You can see the difference right now. Well, of course, it's a plaster model, but aesthetically and you know, I improved a lot of the design, make it natural. Okay, and also when you look at the underneath of the implant, you can see over here, it's very open. This patient had a little problem with her hygiene, so we had to make everything smooth and make sure the brush will go underneath the implant to make sure the patient can clean underneath her pontics. So that will be my case, as you can see. And after, you know, since I talk about my case, now I like to talk about the actual zirconia coloring technique by using BND's liquid. And I'd like to show you the live technique right now. For this case, as you can see, it's a removable zirconia case. And as you can see, we use some attachments inside. And I like to show you how I do coloring on these zirconia cases. The good thing about this is we don't have screw holes. It doesn't have to be cemented. It's always removable. So that's something good about this case.
Okay.
Okay. So let's start the actual coloring. And as you can see, we always like to have pink tissue. So I'm going to always start coloring from my pink tissue. But one thing with these attachment cases, we have issues about these gray colors of the attachments. So in this case, you can see over here, it's very thin. So if we just color pink, we might see the gray color showing through from this side. So we like to first opaque inside the attachments, and then we're going to start with the pink coloring. So right now I have BND's color, and actually the good thing about their color is they have different opaques strength. So this is lighter, 1, 2 is medium, and 3 is strong. So for these attachment cases, it's good if you use something strong. This number 3 opaque is very good, very effective. It will shut out all those gray colors. Okay, so just use liquid. It's very simple. We're going to apply like 3 times inside in the attachments. Okay, so just go around. Okay, 3. Okay, so we're going to go 3 times. Sometimes without these opaques, it's going to really ruin your art. Since you spend a lot of time trying to create something really natural, we always like to make sure that we have a little opaque that will cover that metal color, not to ruin your art. Okay, so 3 times.
3 times underneath.
All around,
we
yes.
cover the tie base color. Okay.
Yes. And then what we're going to do is we're going to start doing the pink. So pink, we have standard and light. Okay, so in this case I like to have a little intense color, so I'm going to use a standard pink. Light is a little bit lighter, so we'll go with standard pink. And we're going to use a lot, so I'm going to use a bigger well. And also sometimes it's hard to visualize the color, so I always use coloring food.
We can buy the wall green.
Yeah, it's always.
Yep. Okay.
Yep. So first, I will start from the interproximals.
Reason?
Interproximal, we need to go a little bit more detail. We need a finer brush tip. So we have to be careful because we don't want to have the pink around the crown area, because the pink is very intense. So once it touches the crown, you're going to end up with a pinkish crown. So we like to make sure we go with a fine brush and we make sure we don't color the crown. And some of the cases, well, in this case, we are doing a layer porcelain over the facial. So you don't really need to have a real intense color, or you don't have to be really fancy about the color. So we're going to go applying the color 1 time. But if you like to have more intense, and if you're looking for something color from the zirconia itself, you might want to apply like 2 to 3 times to get that stronger color. So just to approximate. Okay, so just follow the cervical line. Okay, to proximal. Okay, and also we'll go to the lingual. Do the same thing. Even when you apply the color, you don't really want to touch the actual tooth very close to the teeth. You can just keep a little space in between, because basically the color will spread underneath. So you don't really have to worry coloring exactly right to that line. Okay, and right here you can see the opaque coming showing through. But once we apply the pink, it will push that opaque color back inside, so you don't have to worry about the opaque showing on the surface. Okay, so we went all around, and then we're going to use a bigger brush, and now we're going to just go apply faster. And when you apply inside, when you have these connectors, the sprues, you want to make sure that you put a little extra color around those sprues, because when we cut the sprues, you're going to see the white zirconia and you're going to see those white sprue marks. So we always like to have a little more color around the sprues. Okay, same thing, we're going to go all around. Around the sprues. Always extra color. Okay. And now we're going to go outside. So if you're going, like I said, if you like to do detail coloring, for an example, let's go in like one layer right now. But detail coloring, you can go like 1 time, maybe 2 times, extra in between. And you don't really like to color the whole surface the same amount. You like to go inconsistent. By doing that, it will create a natural color, because natural color, it's not always solid pink. You always have like different tone of the pink. So you like to have a little different color in between to create that natural looking. Okay, so we're almost done outside. Okay, once outside is done, we're going to go inside. Okay, we're almost done. Okay, and again, when you apply your pink, please make sure that you don't have any pink color still undry on the surface and touch it, because if you once touch it and if you touch your teeth, you're going to turn your teeth into pink and you're going to ruin the whole thing. So we have to make sure. Okay, so now you can see everything is colored. Okay, then from here we're going to go to incisal and the bodies. Okay, so the good thing is we're going to use incisal. In this case, it's going to be shade A1. So we have different incisal colors, of course. This time we're going to use the lightest one, the 2.0. This is a incisor enhancer, and we can use this as an incisal. And for this case, like I said, it's going to be a layered zirconia crown, so we don't really have to worry about so much of the details. But we like to have a little incisal translucency effect around the incisal edges. So we're going to use this enhancer. Let's start from the incisal. I usually go like inconsistent line. Okay, like that. If you like to have something stronger, you can apply 2 times, 3 times, make it stronger. But this case, yeah, we're gonna have more control with the final ceramic, so we don't really have to worry too much. So I'll just go like 1 time. But always these zirconia coloring, these inconsistent line, uneven lines, these will create a natural looking. So you always want to make sure that freehand and try to make something natural look by using different strokes and length of these lines. Okay, so that'll be good enough. And now, of course, on molars, these are almost like full contour zirconia monolithic. We're going to apply a little bit on the facial, but basically it's almost like monolithic. And occlusal area, we like to have a little translucency effect. So around the edges, a little incisal. You don't have to cover the whole thing, just go with lines. And yeah, also, well, sometimes people like to play with the lingual too on the incisal edges. So if you like to, you can also go. Okay, so you can see this is our incisal.
Occlusion view?
Okay. Yep.
Thank you.
Okay. Alright, so now we're going to go with the final body color. And in this case it's an A1, so we'll go with A1. Oh, there it is. Okay. And A1 too, I like to use a little food coloring, because as you can see the liquid is really, the color is thin, so just to visualize a little bit more. It's good to have a little color. So I'm going to use yellow again, a little stronger color. And in this case it's a bigger, we don't have to go really detailed, so you can use a bigger tip brush. Okay, so this is the way I do it. First, what you do is vertically from bottom to top, just go straight. Just roughly. Of course, you don't have to cover the whole thing. For the body color, we're going to actually apply like 3 times. So the first layer, we're going to go from cervical to the incisal edge, right up. Just go roughly. We don't want to spend too much time on here, so just go. Okay, so we're going to do the same thing all over, around, even the occlusal too. So first angle. Okay, just go up. Okay, and then occlusal. Okay, so everything is basically covered with the first layer. Let me just make sure. Okay. Okay, from here, now we're not gonna color the 1/3 of the incisal edge, so it's gonna be from here, from this area. We're just gonna go with the second layer. That's our second layer. First, we have to go on the lingual too. and occlusal. Again. Okay, so that's our second layer. And you can see there's still places that are not colored, but it's okay. Like I said, the color will actually spread inside, so you don't have to worry to cover the whole thing. So we'll go with the third layer.
Only cervical 1/3 and slightly body.
Yeah. And some people ask me, like, the way I color it really roughly, so people are like, are you really sure it's okay? But at the beginning I was talking about inconsistency of the color. So natural tooth, when you look at the color, it's not always A3. You can see some part of it like A1, maybe A2. And there's always difference in color, so that will create the natural effect. So you don't really have to go exactly and make sure you're coloring the whole surface. You like to have something a little bit uneven to create something natural. Yeah, even in nature, there's nothing straight. It's always a curve. Everything is, when you talk about nature or natural stuff, it's always curved and it's not straight. It's always uneven. So that's the same idea. Color your full contour zirconia. Okay.
Third time you did it.
Yes, this is my third time. Yes. Occlusal 2. Okay. Yep. Okay, so now we're almost there. Finally, I'm going to do the final touch-up. It's very easy. Since the shade is A2, I always like to put a little stronger color into proximally and the lingual. So I'm going to use a little A2 over here, just to have that effect. So it just has to be a little bit. Okay. So it's going to be A2. Let's use another yellow. Okay. So interproximally. Okay, just a little bit. So we're going to just go under interproximal. By doing this, actually what happened is it's going to help you to individualize each tooth, because interproximally we have a little more darker color because of the shadow. So to create that, we put a little darker color in between to create that effect. Okay, so one time is good enough. Also on the lingual, we can have a little stronger color, so if you like to put a little color over there. And occlusally, we like to, well, sometimes, well, today they don't really stay in the grooves a lot, so we like to have a lighter body color showing through. So in this case too, we'll just color the groove. Okay. Use a little finer tip. Okay. And just follow the grooves. Don't try to color the whole occlusal surface. Okay, so over here. Over here. And over here. Okay. Same thing. Just follow the grooves. Okay, so that will be your final coloring. And after this, you can just put it in your center furnace, and tomorrow morning we'll see the final result.
Awesome.
Thank you.
Okay guys, this is yesterday from Shin and the Shin painting. So this is after 10 hours then we baking. I would like to show you. So after we done, and then continuing about the coloring. So this is a color. We made it, as you see, as you can see, has a little bit translucency. Can you see? And a little bit body in between the two color. And here's occlusion. So this is final baking. So this is color concept. So we made it. That's great. Then we can cut the whole sprue, and then we put it back to the model, and then we layer about facial, which is Dr. Swan.